basically in the last 8, 9, 10 years, a substantial part of Benue State has been sacked by the activities of headers. About 7, 8 local governments have remained sacked in the last 8, 9, 10 years. And this has created conditions for IDPs. A number of these people that have been sacked in their respective homes are in IDP camps. And so we needed to look at the extent to which these people have moved to IDP camps, their numbers, and how it has affected their socioeconomic and political lives. So basically, that study was to look at the activities of IDPs in respective camps. So in Benue State, we found out that there are well over close to 7 or 8 of 9 of those camps. Some of them are official camps, some of them are unofficial. What do we mean by official and unofficial? The official camps are established by government, and government to some extent is able to cater for those people in those camps. But for the unofficial camps, these were not established by government. The people didn't have anywhere to move to, so they either ran and settled in one primary school or one government facility or the other. So officially they were not created, or they are not created by the government. They are created by the displaced persons. So we have these camps here and there in Benue State. And many of these people living there, women, children, and the aged, they have been mostly affected by this crisis. Some women have had children in camp. Some men have, elderly people have died in camp. Children have not gone to school for as long as 8, 9, 10 years. My local government, particularly Benue West local government, half of that local government has been sacked for well over 9, 10 years. And it has really been really pathetic. And you can find all of this across the 7, 8 local government I said have been sacked by the activities of headers. So that is the condition of internally displaced persons. The number is massive. The internally displaced persons are in their thousands, finding ways of survival. Some of their children the children of these IDPs have become destitute. Some of them have become beggars on the streets of Benue and elsewhere. Some of them have migrated to other parts of the state and looking for ways of survival. And so this is what we discovered in the study, in summary.
Okay, sir. I would like to start the question from the angle of the official and unofficial camps. The new administration just came in and he has said that he's going to recognize all the camps in the state. What do you think will be one of the biggest challenge for the new administration in terms of catering for these displaced people?
For me, the biggest challenge will be how the government will be able to raise finances to be able to address the challenges of IDPs. Like I said, these IDPs are in their thousands. And, even catering for those ones in the official camps took its toll on government. And now that you are going to of course, that is the right thing to do, because there shouldn't be official and unofficial camps. Why do you have official and unofficial camps? Because the IDPs are all in the same condition. They are facing the same challenges. So first and foremost, I commend the government of Benue State for resolving that there should be, all of them should become official camps. But for me, the challenge will be the resources to manage all of these camps. I'm sure the state government has done its homework, and they are sure that they will be able to provide medical care, provide food, and provide some of the things that the IDPs will need in the camp. But for me, that will be the major challenge.
Okay, can you tell us some of the physiological and psychological impact when you are doing your research in some of the IDP camps?
In fact, it has been the psychological effect on the IDPs have been massive. Like I said, many of them, the children for 7, 8, 9, 10 years, those children have not seen the four walls of classroom. Now, you know what it means. The implication is that for some of these children who were in primary 3, ordinarily they would have been in JS3 by now. Some of them who have not started school are already 10 years. It is going to have, multiplier implications for our security in the nearest future, because these children have not had the privilege of going to school. The economy of these local governments has been bastardly affected because most of these local governments from the markets, those communities, the markets have been closed for close to 8, 9, 10 years. The economy, family economy, has been in jeopardy because most of these families have not been able to raise resources to run their families. They have become beggars. Their conditions are really very pitiable. And so looking at the psychological effect, it just cannot be quantified. You go to the IDP camps and almost immediately you feel like crying. As I speak to you, it is raining. Under the sun and in the rain, those internally displaced persons suffer those conditions. When it is raining on them. When the sun is hot, it is on them. And so some of them hardly have places to sleep. The children, some of those children, women have been in labor in that condition. So if you go there, the psychological effect is indescribable. Frankly, it is indescribable. And I think as a country, we can do better than what we are doing.
In terms of enumeration of gender and even the children, from your research work, can you tell us in terms which one is the highest? Is it the children, the women, or the men?
No, what we did in our study was to look at the vulnerable, and then the vulnerable here we looked at women, children, and the aged. But basically, when you look at the children, girls, the ones that are still children and still youthful, and of course youth generally, you find that they constitute the highest number in the camp. Girls are mostly affected. Some of the girls have been impregnated in that condition. People have taken advantage of the fact that these people are displaced and they lack everything that they need, and they have become beggars. A number of those girls have been impregnated and have also delivered in camp. And this has further compounded the problem of these girls in those IDP camps.
Okay, from can you tell us the method you use in the research work for the vulnerables?
What we did was to do focus group interviews, and we visited virtually all the camps, both official and unofficial camps. And so in order to get a clear view, a sociological, anthropological view of what was happening in the camps, we did focus group interviews, and we also did personal interviews with a number of the IDPs to elicit and get information directly from them. So if you read the study, you will find us quoting directly from what these IDPs told us, particularly with respect to their health, particularly with respect to medical care, feeding, and other aspects of what they've been going through in the camp. So based on that, we were able to generate the information that we arrived at.
Can you share some of the recommendations you deduced from the report and how it can be implemented?
Well, first and foremost, we said there is need for government to ensure that these people are able to go back to their respective homes. It is unacceptable, totally unacceptable, that people in their own homes have been displeased and other people have occupied those environments. It shows that the state, which ordinarily should have the instrument of coercion, is unable to use that instrument of coercion to provide security for its own people. So what we are saying is that first and foremost, these people we need to clear those places and allow these people to go back to their respective homes. occupy their respective homes. In the meantime, there is need for the State Emergency Management Agency, which has been doing enough to, 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 to increase their level of intervention. But beyond that, we are even more worried that the National Emergency Management Agency has not done enough as far as this intervention is concerned. And so we suggested and recommended that the National Emergency Management Agency should intervene and assist IDPs. And then there is also this problem of we also think that government needs to secure its own people. There is no way government can achieve set goals if there is insecurity in the country. So it is the responsibility of government to provide security. And so we recommended that government should try as much as possible to provide security. As we speak, 2 days ago, the headers still attacked people in my community and so many people were killed. And so what kind of country do we want to live when people are not secured in their homes? So the basic recommendation is that government should provide security for the people. The National Emergency Management Agency, working closely with state emergency management agencies, should ensure that the IDPs are well catered for. Basically, those are our recommendations.
Okay, do you have any other thing you'd like to talk about that I didn't ask you?
First and foremost, I would like to thank you for going into these areas. It's an area that we need to. It seems that perhaps because of the extent of IDPs we have in the country, North Central, Northeast, and other parts of the country, it is no longer an issue for conversation. We have taken it as a new normal. People don't seem to even care that people are living in IDP camps. So all we are saying is that government needs to intensify its intervention, especially in ensuring that there is security for Nigerians along, irrespective of ethnic group and so on and so forth, because that is the basic thing you can provide. There is no way this government can do well if the people are not secure. So I just want to reinforce the fact that as a country, we need to do better than what we are doing today. We cannot live in our own country and people will become homeless. From their own home, they suddenly become very homeless. And I think government will lose its credibility and its legitimacy if the people begin to lose confidence in a system that is supposed to protect them, and suddenly is no longer doing that. Thank you.
Thank you, Professor, for your time. We appreciate it, sir.
Okay,